How's it guys? Welcome back. Today we're doing the part 2 of the 3-part series. Today we're going to be doing slow rhythms and fast rhythms. Those first degree, second degree and third degree heart blocks. If you didn't watch my previous video on like basic reading of ECGs, I'd recommend you go read that first, but let's jump straight in. So this is a sinus tachycardia, as you can obviously read. Sinus rhythm, because it's coming from the SA node, the sinoatrial node. Remember, if you watched my previous video, that is the pacemaker. The reason it is a sinus rhythm is that we have P waves. So if your rhythm is coming from the SA node, which is the sinoatrial node, which is the pacemaker of the heart, it is a sinus rhythm. So the word tachy obviously means fast, and the word cardia means heart. So a fast heart rate coming from the SA node or the sinoatrial node. So how do we know it's fast? Well, remember, we need to count how fast the rhythm is, and if we take the block method, so there's one block, there's 2 blocks between the R waves. Remember, these are your R waves. So we're going to take 300, we're going to divide by 2, which pretty clearly gives us 150. That is a fast rhythm. Remember, 60 to 100 is normal. So our P wave is the right length, our QRS is the right length, and our T wave is less than halfway between our R and R. So normal rhythm, it's just fast. Alrighty, let's look at this rhythm. It's not written there, so it's not obvious. What do you guys think? So let's see, our P wave is normal, our QRS is less than 3 little blocks, and our T wave is within halfway. So we're cool with that. So what is the problem here? Well, it looks pretty slow. The other question you need to always ask yourself, and it may seem a bit of a strange question, is there a P wave before every QRS? And is there a QRS after every P wave? Because you can have situations where the one works but the other doesn't. So that's something to be aware of. So now that we've checked that the rhythm is normal, let's look at the speed, because it looks a little bit slow. So remember, we can have the 300 rule. We have 1 block, 2, 3, 4, 5, 6. It's almost 6. This is also almost there, so 6. 300 divided by 6, I can tell you now without even using a calculator, that is less than 60. So clearly this is a bradycardia. So you have Brady, which just means slow, and cardia, which is heart, slow heart rate. Pretty basic. Alrighty, now we're coming to something a little bit more complicated. Also a very familiar rhythm. What are we looking at? So we're looking at big rhythms. We're looking at lots of movement. Like, what exactly are we even looking at? What we're seeing is just a really big ventricular rhythm with a T wave. Does that make sense? So ventricular rhythm, T wave. Ventricular. So this is a ventricular tachycardia. What does that mean? So, or a VT. So a ventricular, so the ventricles, remember the heart is made out of your atria and your ventricles. And so this is a ventricular rhythm, meaning that the rhythm is being generated by your ventricles and not by your sinoatrial node. Obviously, because your SA node has failed and now your AV node has taken over, that now your atria are not working properly and that your ventricles are now taking over the rhythm. This is generally a bit of a slower rhythm, so that's why this is a ventricular tachycardia, because it's fast. It pretty much just looks like this big bounce, and that's just because it's looking like a big ventricular rhythm. It's just looking like a big ventricular rhythm. What are we looking at here? I'll give you 10 seconds to guess. Oh wait, it's written right there. Great. So ventricular fibrillation. So ventricular means the ventricles of the heart, so the big part of the heart is fibrillating. So it's all contracting at the same time. So what we see here is just random up and down, random up and down. Some are bigger, some are smaller, some are shaped weirdly, some are just, it's just all abnormal. That is a ventricular fibrillation. There's no pattern, there's no specificness to it. It's just random. It's just random. And that is because every single cell in the heart has the capacity to contract. And so when your heart becomes too low on oxygen, your heart goes into ventricular fibrillation because all of your cells start to just contract at their own rate and at their own speed, and then you go into ventricular fibrillation. This is a shockable rhythm. And if you have this rhythm, you have no pulse because technically your heart has stopped beating properly. And so we defibrillate you with an AED or whatever else machine you have. And then we have this one. What do you think? You can ignore the Asystole because that's the label. Anyway, so we have what looks like an almost flat line. This is an important point. You see, that's a flat line. That's a flat line. But you notice that it's not flat. It's not perfectly flat. All right? And so you might be like, James, well, why is it not perfectly flat? Because the heart is always going to be showing some conduction. And that's why a asystole is never perfectly flat. Asystole just means that there is no conduction moving through the heart. You see how there's no like P wave, so you see how there's no P wave or QRS or T wave or anything like that. There's just nothing. It's an asystole. It's just a flat line. If you see this on a patient, it means the heart is doing nothing. There is no activity. The heart is dead. Sad, but that's what a dead heart sounds like. And it goes beep. I can put a noise here so you can see what it sounds like. What's next? What's next? Given away, it is a heart block. So what are heart blocks? So different rhythms cause the heart to go into different rhythms, clearly. And what happens is that you get a first degree, you get a second degree, and you get a third degree. And these are all slightly different, and some are more dangerous than others. But, in some cases we need to know how to diagnose these, and this is how you do it. So a first degree, the only thing that is different is that your P wave and your Q wave, so this is your PQ interval, is greater than 5 tiny little blocks. So we have 1, 2, 3, 4, 5. See? It's wider than 5 blocks. Other things you want to ask yourself is there a P wave before every QRS? And is there a QRS after every P wave? If there is, we're happy. And we can see that every time the P and the R interval is the same, we have a first degree heart block. Pretty straightforward. Alrighty, this is called a second degree type 1 or a Winkelbach. Don't know what language that is, but so what's happening here, all right? Questions. Look here, we have a E and a QRS and a PQ interval that is normal. But then you see here, it gets broader and it gets broader. And then we have a P wave and there's no QRS. So that's really important. So this is the super important piece about a type 1 second degree or a Winkelbach, because the PQ interval gets wider and wider until it drops away. See, there's a missing gap, and the PQ interval gets bigger. It's gradually gets bigger. And so you'll see here again, your interval gets small again, and then it gets wider, and then gets wider, and then drops. So remember the things that we were asking you guys to look at earlier was, is there a P wave before every QRS? And is there a QRS after every P wave? And the answer is no. You see, there is a P wave, and there is no QRS. So that tells us there's something going on. And this is a classic second degree type 1. Alrighty. What are we looking at here? Let's assess. So there's no label, so it's not given away, which is great. So let's look at P waves and QRSs. So we have a P and a QRS and a T. We have another P, QRS, T, P, nothing. So there's a P wave and there's no QRS. P, QRS, T, P, oh, nothing. P, oh, nothing. P, QRS, T. So what's happening here? We have a P wave and a QRS that follows every time, except for there. You see P, no QRS, P, no QRS. And it's unpredictable, and you see that the PQ interval is the same. Let's get rid of some of the mess. PQ interval is the same, PQ interval is the same, then it just drops and it just drops. This is a second degree type 2. And that's not how you spell type. And the important bit here is that your PQ interval is the same as every other PQ interval, except at some point the QRS just drops. And that's what's important for a second degree type 2. All right, what are we looking at, folks? I see a P wave and I see a QRS. And then I see a P wave and I see a QRS, and then I see a P, and then I see a P, and I see a P wave, I see a QRS and I see P wave. So what is happening here? This looks like a typical third degree. Third degree. So how do I know it's a third degree? What are the definitions of a third degree? So there is dissociation. Dissociation, big word. So your P waves are regular. That's the most important piece. And what that means is that your P waves are going to continue as normal, and your QRS is also going to continue as normal. So these are dyssynced, they're disaligned. So if you look at your P waves are consistently the same throughout. You see, so it's 1, 2, 3, 4 blocks. 1, 2, 3, 4 blocks, yeah. 1, 2, 3, 4 blocks. 1, 2, 3, 4 blocks. 1, 2, 3, 4 blocks. So you see how we have 4 blocks, 4 blocks, 4 blocks because our P waves are regular. A second degree type 1 will not have regular P waves, and a secondary type 2 will also not have regular P waves because obviously a QRS just drops randomly. Where here we have absolute dissociation, so there's a distinct between your P waves and your QRS. So you may even have ECGs where you have a P wave inside the QRS, and so it might be hard to see. But if you just make sure that your P waves are regular and your QRS is regular, you see 2 there, so it's like a bigeminy or whatever you want to call it. So they're going in sets of 2 the whole time. So as long as it stays regular. And that is a third degree heart block, or a complete heart block. Complete heart block. My handwriting is terrible. Should have been a doctor. Anyway, so that is that. I hope you enjoyed it. Our next section will be on 12-lead ECG and how to diagnose a STEMI. If you did like this, please like and subscribe. It does help the channel a lot, and I appreciate your time, and stay well, stay safe. Bye for now.